Okay, so these are just our questions that are at the beginning of your chapter, our learning objectives. We're going to be talking about the role of the front office assistant. So some of those roles are going to be positive attitude, greeting the patients on the phone and in person, creating and managing an EHR for each patient, generating patient letters and other correspondence, and providing patient education material. Okay, so those are just a short, that's a short list of what you'll be responsible for, but what do you think is the most important thing in that list?
Attitude.
Everybody agree?
Yes.
She's right. Positive attitude is going to be the biggest thing here because you're the first impression. If you're the front office, you answer the phone, or if you're answering the phone and you're in the back, a positive attitude. Whenever they're calling, you're the first impression for that particular time for that patient. So a positive attitude. You guys remember me saying when you answer the phone, you always smile. Hello, how are you? Because when you smile, it sounds like you're smiling. So sometimes I'm going to say, hello, how are you? So communication in the medical office. We have one opportunity to create a positive first impression. So good communication improves patients' confidence in their care. It increases satisfaction among patients, and it safeguards confidentiality. One of the things that I want to bring up here is malpractice. If a patient has a suitable reason or an actionable reason for a malpractice suit, a patient who is happy and has good relationships with the clinic or the facility, they are much less likely to sue than someone who is unhappy. So keeping the patient happy just benefits everybody all the way around. Have you ever called the doctor's office and gotten someone who did not sound cheerful?
Oh, yeah.
Yep.
Did that influence your opinion of the office?
Kinda.
Oh, yeah.
There have been
Kinda.
times, yeah, there have been times that I've called a doctor's office and spoken to someone and was going to actually be a new patient, and I didn't like the way they sounded on the phone, and guess what I did? I moved on to the next one until I liked the person I was talking to. So that's where that positive attitude really does come into play. So telephone etiquette. Telephone is usually the first communication between staff and the patient. First impression of the office is just key. Professional, positive, pleasant tone when answering the phone. The 3 P's, professional, positive, and pleasant. So the most common types of phone calls in the medical office are going to be appointment requests, inquiries from prospective patients about the practice, requests for medical advice from a physician or a nurse, prescription refill requests, insurance and billing requests from patients, information requests from insurance companies. There's also a couple of more that aren't listed that I'm just going to tell you. It is also common to get questions from pharmacists, medical supply vendors, other medical offices over the phone. So your guideline for proper telephone etiquette. Do not use office telephone lines for personal conversations. Keep your cell phone conversations short and private, and take such calls only while you're on break. Do not wear a Bluetooth or other cell phone earpiece during working hours, and greet the caller by the second ring if that's possible. If you smile as you answer the phone, callers will hear the cheerfulness in your voice. You need to speak slowly and clearly, adjusting your volume if you know or you suspect the caller has a is hearing deficient. Y'all, I have to tell you, at ACS, it never failed. I got the 99-year-old patient that had their hearing aid turned off. And what's really funny is like the next 3 phone calls after that, it seemed like I still yelled at them because I couldn't get that out of my head to yell. But you just have to gauge that as you talk to each individual person. Obtain the caller's full name, a return number, and the reason for the call. Verify any spelling and contact numbers for accuracy and summarize the reason briefly and precisely. If it's necessary to place the caller on hold during the call, do so only after asking the patient's permission and awaiting a response. If you say, Mrs. Jones, I am so sorry, I need to look for something. Could I possibly put you on hold for just a few minutes? And you say it nicely, it's hard for them to say no, right?
Right.
Well, and then you summarize the reason briefly. I need to be able to read this on the computer, whatever the reason. I need to go pull your chart, whatever the reason will be. If it's necessary to place the caller on hold during the call, do so only after asking the permission and awaiting response. I just said that. Limit the hold time to less than a minute if it's possible. And document your conversation with the caller along with the time and the date and your initials. Because if you don't document,
Didn't happen.
did not happen. Appointment confirmation. A reminder that the doctor has reserved this time, a request to return the call to confirm the appointment, a request to bring to the appointment a list of current medications, a reminder for the patient to check on his or her referral status if the patient's insurance company requires a referral. Automated systems are available for making confirmation calls, but in most small and medium-sized practices, front office assistants are expected to do so. You will only know that when you get hired onto your facility. Compose a phone message in SIMS chart. Have you guys been on there poking around?
Yeah, but I didn't on this. I've been working on critical thinking.
Okay. Well, in order to compose a phone message in SIMS chart, I'm just going to read down. It's right there for you. Click on the correspondence icon, select phone message template from the left info panel. Click patient search button, assign the phone message to the correct patient. Confirm the auto-populate details and enter any necessary information based on the phone call, and click the Save to the Patient's Record button. Let me see.
Miss Lisa, where I showed you the other day when I was over there helping you get that stuff set up, that's where you're going to find your phone messages at.
Okay.
At the end of our little video here, if I have enough time, then I'll pop in and show you where it's at.
Okay.
Patient correspondence can be referral patient letters, emails, phone messages, increases satisfaction and understanding among patients, and safeguards confidentiality. Physician referrals. Physician referrals. Oh my goodness, y'all. Does it feel like it's Monday to y'all? It does to me. I'm going to try to get myself straight here.
You're okay.
Front office assistant of the referring provider will complete a referral form. Front office assistant should have basic understanding of terminology and coding systems. And once the specialist has seen the patient, he or she will contact the referring physician by phone or letter to outline the treatment plan. Okay, so here's some of the patient letters that actually get sent out. New patients welcome letter, appointment reminders, discharge letters, requests for payment, and terminating the patient-provider relationship. So those are just some of the reasons why you may send a patient letter out. Now we do so many of those things by text, but I still think they use, as we call it, snail mail a lot too. Okay, secure emails. Using the messaging system built into the EHR application ensures secure delivery of email within the practice and offers a way to communicate with staff regarding confidential patient information. It's inexpensive. It's quicker than snail mail. Encryption technology is available. HIPAA disclosure statement, EHR messaging, inter-office only, and patient access. You know those patient portals that they have us set up now? That's part of the EHR system. Okay, guidelines for sending professional email. It's always important that you make sure that email correspondence reflects professionalism. And this is this you can find it in box 4.3 in your book, and I'm not going to read through all of that. You guys, when you're reading your chapter, can do that, or if you haven't already, do that. Faxing. The fax, like email, enables quicker message transmission than traditional mail. However, it poses several security and integrity risks. Faxes can be misdirected because of human error or technical glitches. The recipient of a fax cannot be verified because anyone can pick up the printed document on the machine if the machine is placed in an unsecure location, and it is difficult to verify that all pages were received. So what is one thing that you can do to make sure that your fax is more secure?
First thing is a cover page.
A cover letter. On that cover letter, it's going to tell you how many pages you're sending. What's something else you can do to make sure your fax is going where it needs to go?
Verify the number.
Verify the phone number. That's right. Fax machines, what happens is once you send your fax, it actually prints up behind it a confirmation little thing. And you can double check your phone number there too, and then you can double check how many pages it actually faxed with your cover page. What do you do with the fax once you're done with it?
Save it in a file.
In a correspondence folder, right? You also need to document if you're faxing something about a patient, you need to go into the patient's account and document sent fax on 4/8/2020 at 10:30 a.m. Copy of fax found in correspondence folder, April 2020. Do you know why you would put all of that?
Because you're documenting.
Yeah, that way, if Dr. So-and-so comes in and says, did you fax so-and-so and so-and-so? You can pull up that patient's account. You can see that you documented that you sent it, and you know exactly which correspondence folder to go in and find it. So therefore, you have covered your bases, right?
Right.
That way, if the recipient says, I didn't get that, you can say, well, I sent it, but I'll redo it.
Yeah,
Right.
that way you can show your doctor, I did follow your directions, I did get this done, but you know, something fell off on the other end. And then all you have to do is make a new cover letter with the appropriate date on it and resend it, and then put it back into your correspondence folder. And you're going to document, resent, blah, 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 blah. Excuse me, I'm burping coffee. Okay, guidelines for faxes. We just talked about most of these. Document the date and time and initial the fax information to create a paper trail. File the completed cover sheet in the patient's chart. They say do it in the patient's chart, but I don't know. You have to ask your facility how they want that done. You're going to inform the recipient before sending any confidential patient information so that it can be retrieved immediately. Use a cover sheet. Follow up with the intended recipient to ensure that the message was received.
And another thing you can do is, like, on the cover sheet, put attention so-and-so. That way, if somebody else does pick it up, they'll put it in the right mailbox, hopefully.
Absolutely. Thank you, Joe. I didn't even, I know that, but I don't have a cover sheet in front of me, and so it didn't come there, but thank you for that. Okay, incident reports. An accurate and complete incident report is an excellent tool for reducing risks for patients and employees. It's used to communicate situations to the risk manager, reviewed by staff to see what caused the incident and what can be done to prevent it from happening again, and completed by employee who witnessed the accident. That's talking about if you have a patient that comes in and they slip in the waiting room, you're going to have to fill out an incident report. Managing electronic health records. The EHR is only as good as its security. EHR is monitored daily, ensuring proper software updates, continued training efforts, and responsibility of the entire office. Your office manager will make sure, or should be making sure, that you're getting all of your updates unless she has tasked you with that, and then your EHR company will always contact you and let you know, Hey, Miss Sue, we're going to be sending an EHR update. Can you run that blah, 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 blah. So, and I just picked Miss Sue just because, doesn't mean just Miss Sue, but anybody that's working in the office. Not just Miss Sue's responsibility forever. Eliminating duplicate charts. Oh my goodness, guys. When I have to tell you, this doesn't sound like a big deal, but when you're a busy practice and you don't double check to make sure if your patient's new or established and you just put in demographics and create new charts, it creates a nightmare for the billing and coding portion. So duplication creates a serious problem because it divides the patient information between two charts. Because what happens if Miss Smith has two charts, just two account numbers, and she came into the office at the beginning of the month and we billed this one, and then she came in at the end of the month and then we billed this one. Do you see how it's separating everything?
Also, it might make it harder for payments and stuff like that because it might show on one account that she hasn't met her deductible and she might be charged more.
Right. So it is so important for you to check the name, check the date of birth. I just suggest date of birth just because that's an easy way to pull up anybody with that name on that date of birth. Just make sure that you're not duplicating your demographics and making patient duplicating the charts. You need to ask whether the patient has ever been seen by the practice before. If so, use the already established patient EHR. Ask established patients if they have had a name change, and always set up the patient EHR account using the name listed on the what?
Insurance.
The insurance card. Patient records. Patient health records are classified into three groups: active, inactive, and closed. The retention periods vary from state to state. Patient health records must be maintained for evidence of patient care in the event a lawsuit is ever filed. And then purging. Purging is a process of separating inactive and closed patient health records from those that are active. Integrated devices. EHR has to talk to other devices used within the organization. Scanners are used in several ways. Obtaining the patient's signature electronically can be accomplished by having a patient sign on a signature pad. And all integrated devices need to be able to keep the patient information protected. Cameras are also used to help establish patient identity at check-in and to perform certain procedures within the healthcare facility. I have absolutely no experience with the camera stuff, so.
No, never seen it.
Yeah, I've not encountered that here, but doesn't mean that it's not available.
Right.
Backing up the electronic health record. Patient confidentiality and security must remain as much of a priority for the backup copies as they are for the primary EHR systems in the medical office. One of the things that you have to have for backup is secondary offsite location, charged portable laptop purchased through a vendor, and offices must have a written backup and recovery plan in place. So if anybody ever hacks your EHR, you have a plan in place already. I've only ever seen a system hacked one time, and that was Natchitoches Regional Medical Center. And it was bad. They call it pirating, and they had to pay a certain amount of money before the pirates would release the information back to them.
Oh, wow.
And then they had to contact every single patient that they've seen in the last 6 years, because that makes them active, and let them know that they had been pirated and that their information may have been disclosed. So it's a nightmare. Okay. So we're going to talk a little bit about the calendar. When an appointment is scheduled, the patient's demographic information is auto-populated in the appointment book. This allows the healthcare staff to verify insurance eligibility, confirm appointment dates, or edit payment information. Electronic appointment book is the key to efficient time management. Several users can access the electronic appointment book at once. Can be printed out daily so that the doctors, medical assistants, nurses, and receptionists are all aware of the patient load for the day. and patients can be easily rescheduled, and appointment availability can be searched based on patient preferences. I always like to have a paper copy of everything just because I'm just that person. But when you get to your new facility, they will let you know what the expectation is for the calendar and appointments. So calendar views. The SimsChart scheduling system offers many different views accessible from the blue tabs on the left side of the screen: daily, weekly, monthly, exam, and provider. Users can also view a patient's next scheduled appointment using the search field. And the SimsChart scheduling system offers many different views. Okay, I've already read that, sorry. It has it twice on mine. Okay, so we have 3 types of appointments. Patient, block, which would be holiday, lunch hour, or travel, and other, staff meeting, vendor meetings. Appointments are entered into the system using the Add Appointment button on the left side of the calendar. So block appointment time. Appointment slots should be blocked out as soon as you know the time has become unavailable. Holidays and other office closings should be blocked at the beginning of the year. When we pop in, I'll show y'all that too. Double booking. Assigning more than one patient to the same appointment slot. Performed when practice expects a no-show. Patients are expected to arrive early or late. Appointment is expected to be brief. Appointment requires different rooms and resources and urgent medical problems. For example, some practice may allow double booking only during the first appointment of the day, whereas others prefer double booking slots directly before the lunch hour. Your facility will let you know. So was that informative? Hey, Sid. Jordan, are you okay? All right, I'm gonna see if I can go into my SimChart for the medical office. Let's see. Okay, I wanna get out of this. Well, all right, can y'all see when I do this?
Yes.
Okay. So y'all can see that I'm getting into my account, right? Now remember, you're not gonna go through Evolve, you're gonna go through Canvas. I have a couple of things I wanna show you. If you guys get into your canvas.com account, if you come over here, can you see this little list over here and you click quizzes? There are some practice quizzes that you can take. I've released 2 and 3, and I'm gonna go ahead and release 4 right now. So y'all can just play in those, okay? Kind of use it as a review. Go back. Okay, let me see if I can move this over. Okay, so I'm going into SimsChart for the medical office. Oh, I'm running out of time. I gotta hurry. Simulation playground. Come on. I don't know why my pop-up blocker is on. Have y'all noticed when your pop-up blocker is on, you can't do anything?
Yes.
Yep.
So you always have to have your pop-up blocker off.
Top one.
Here we go. Okay, so here's our calendar views that we talked about.
Now, when we're doing these EHR assignment things, are supposed to go just strictly to this playground, or do we go under the EHR assignment thing? Will it save it under the assignment thing?
Oh, I don't know. I think just do it however it's allowing you to do it. Let me, I don't know, Joe. Let me go back. I didn't think you could get through to this through the EHR.
Well, on the other side of the EHR thing, that's where me and Miss Lisa have been doing it, and it's been
Okay, that's fine. You can do it several different ways. But here's your form repository. Well, we want to go into correspondence because what are we doing? We're going to do a phone message right here. You see that, Miss Lisa, where it says phone message?
No, I'm not on that. Let me look. Hold up.
But
no, she meant look at her screen.
you just look
Oh,
at my
yeah, I
screen.
see your screen.
Yeah, see, if you look up here, it says calendar, correspondence, patient demographics, find a patient, and form repository. Go into
Right.
correspondence, you have a blank email where they were talking about emailing people within the practice or a patient. It's secure this way. And you have a memorandum that you can actually type up whatever the doctor wants you to see. Missed appointment, patient welcome. So all of these things are actually already generated for you. You just have to go into your EHR.
Select one, huh?
Yeah, Miss Lisa, those were the ones I was showing you the other day when I had come by.
Yeah, I got you, baby. They're over here on the left. I see that.
Yeah, and you can't, Miss Lisa, you can't mess anything up. So
Okay,
get in
good.
and play. You can't mess it up. Just get in and play with it and have fun with it. It's a playground is all it is. You can't mess it up.
Okay.
Does anybody have any questions? Okay.
Not at this time.
Not at this time. All right. Well, I'm not going to see you again until next week. So do your practice exams. If you can't find them, let me know and I'll individually walk through with you. I'm glad I got to see you guys today. Thank you so much for your awesome hard work. Joe, you look like you need to say something.
The Quizlet, it's saying that the website is down, so that Quizlet we have on there.
All you have to do is comment. Quizlet is down, and we'll move on. All I'm really what I have for a graded exercise today is the EHR exercise 4.1 through 4.4.
Okay.
So, any more questions?
Are we
Are you going to be
Hi. Do
asking?
you have a baby for sale? Does anybody want her?
I'll take her. I'll take her for free.
Lisa, what were you saying?
I got confused and started doing critical thinking questions instead of the EHR. So
well,
you probably
I did warn you about that last time we talked. The
You
brown
did.
boxes are the EHR exercises, but the critical thinking does nothing but make you think, and then you start beginning to
True.
think like a. So you're not wasting time by doing those exercises. But
Okay, good deal.
if I assigned you guys everything we would do in class, then I would be going crazy trying to keep up with it all. So just make
Okay.
the best out of your resources, and I'm trying to make it easy to follow on Edmodo. But you know, the information is yours, so do as much as you can and learn as much as you can. Knowledge is power. It's not going to be wasted. All right,
All right,
guys.
well, I'll wipe it away from my assignment because I'm on number 4.
Okay.
I'll just
Well,
erase it all.
well, keep it up there. Just keep it up there. You
Yeah,
keep
just
on doing
save
what you're doing and keep it up there. That because you're working hard on that. And I like to see hard work.
Oh, when I
Okay.
talked to her this morning, she said she was already fixing to work on the 4th critical thinking before we ever came on here. So,
Right.
That's
hey, I
awesome.
said, just save it.
Okay, guys, have a wonderful Easter Sunday. I miss
That-
you guys.
That was my
Who
other
else?
question. Are we doing anything on Friday?
No, you're off Friday. It's Good Friday. It is a holiday. There will be, you can work on whatever you want to, but I will not be assigning anything.
Okay.
Okay, no Zoom tomorrow then either.
No, we won't be back at Zoom until, I'll let you know when, okay?
Okay.
When she sends out the text about it, I'll let you know, Miss Lisa.
All right,
I'm
thank you,
glad you do
baby.
because I forget. I'm sorry, Miss Lisa. I don't mean to forget you, but you know, this mind is a
That's
bit crazy.
okay.
That's okay. I called her this morning.
Bye,
She
guys.
sure did.
Bye.
Great
Bye.
day.